Welcome everybody to the second round table of Act 4 of the Mediterranean of the Future. I would like to remind you that the question is how we can withstand and better cooperate when faced with this health crisis in the Mediterranean. As we know, all countries in the region are facing the same health crisis, and we are going to hopefully find out a little bit more about different individual countries and also about the future outlook for cooperation, stronger cooperation among countries around the Mediterranean. So we have a whole panel of speakers here. Sylvie Briand, who is in charge of preparing for emerging illnesses with the WHO in Switzerland. Giuseppe Ippolito is a professor at the Nazareth Spadrazzani National Institute for Infectious Illnesses. He's in Italy. Dr. Maria Betristasi, Director General of the Papa Giovanni Hospital in Italy. Emmanuel Angelakis is a member of the scientific committee of the Greek Pasteur Institute. And we have Professor Lies Rahal, who is Director General of Healthcare at in the Health Ministry in Algeria. Thank you, ladies and gentlemen, for being with us. Thank you, everybody, for joining us and for spending an hour in our company. We, earlier on this morning, talked about pandemics of the past. Now we want to talk about what's happening today, given COVID-19. I'm going to start with you, Sylvie Briand. This is a worldwide pandemic. Everyone is impacted. Every country is impacted to different degrees and in different ways. And on that front, can we count on on statistics to compare the different situations and approaches? Hello. Thank you very much for putting that question to me. Yes, indeed. Figures, statistics, they are just statistics. One has to analyze them carefully. And in terms of a pandemic, when you're analyzing the figures, you really have to take you have to pay great attention to the context, because if you simply look at the number of cases, well, those numbers depend on the capacities in the different countries, and so it will vary from one country to the next. The mortality rate will depend on many things. Also, it depends on the demographics, the age of the population of people who have underlying illnesses. It depends on the quality of the healthcare system. There are always many factors which come into account. Figures, statistics can give you a clue, but the analysis goes much deeper than that. There are common denominators, but you also have to identify how different measures are deployed to counteract mortality. Could I also ask you, today, apparently this virus has been around since September 2019. In Italy, for example, that was the first Western country to be impacted by the virus. We hear that Professor Ippolito is not yet with us. We'll get back to him later on. Is Dr. Emmanuel Angelakis with us? I think he is. If that's the case, I would like to ask you, in Europe, the number of people impacted by COVID-19 is increasing. That's also the case in Greece. What can you say to us about Greece and your latest statistics? How is the illness panning out?
Yes, hello. So the first wave, I'm very sorry, but the sound is very poor quality. I'm afraid it's very difficult to translate. So currently, we can see the second wave with more than 3,000 cases per day. So currently, all of the northeast of Greece is affected with 100% occupation of hospital beds. Yes. So thank you for these initial figures. We will come back to you. So I'm going to come back to you, Sylvie Briand. to talk about this virus that is really putting the health of our citizens at peril, and also the health systems. We're all struggling faced with the pandemic today. Yes, indeed. I think that this is, first of all, because most European countries are no longer used to dealing with major epidemics. And their health system is not organized to cope with such a fast increase in patients. And we're more used to dealing with chronic diseases that require a lot of follow-up. And we've progressed more and more to outpatient treatment. And so when the epidemic broke out, the health systems were totally unprepared to deal with an epidemic. Asian countries reacted somewhat better because they have had some warnings with the SARS and other outbreaks, and therefore they had transformed their health system so that they could deal with epidemics. In addition to that, COVID is a disease that gives rise to some very serious cases, and also patients that require care for a long time, 1 to 2 weeks. So to deal with this type of epidemic, what is very interesting is to consider the health system as a whole and to make sure that the patients can be treated as outpatients with particular precautions when they don't need to be an inpatient, so that we can avoid overloading the hospital system, which needs to increase its capacity rapidly, which is not always easy. So with regard to this, I'm going to turn back to Professor Elia Salmahad. Before talking to you about the case in Algeria, maybe you can say a word about these global health system that is really endangered and the difficulty of keeping up with things, because we are several months into this pandemic now, and everybody is struggling. This is something that we have to take into consideration also. Thank you for giving me the floor. I'm very happy to be with you. So, of course, the pandemic has highlighted the insufficiencies of a system, including the European system. We have all been struggling to deal with the system.
Je reviens vers vous dans quelques instants. Et je repars vers le professeur Giuseppe Ippolito qui est maintenant en place. Professeur, je voudrais vous parler justement de la situation en Italie.
We will now turn to Italy. The information that we have seen recently is that the virus, it would appear, was present as from September 2019 in Italy, which makes it the first Western country to be affected by this pandemic. For a proper connection with the other guests, Mrs. Briand, COVID-19 won't be the last health emergency that the world will be faced with. In a meeting organized in March, the general meeting of the United Nations it was clearly explained that to achieve a sustainable preparation and to break the pandemic cycle, the best response was interstate cooperation.
Alors, je vais vous reposer la question.
Parce qu'il y a eu un moment où le son
I'm not sure if I'm going to ask the question again. What I was saying is that the pandemic that we're experiencing now will not be the last pandemic that we will have to face. And in the last general meeting of the United Nations, it was in last October, it was clearly explained that only interstate cooperation could help us to break the cycle. Yes, absolutely. The viruses do not respect borders, and that is why cooperation is so important, because we cannot imagine that the measures implemented in one country will prevent transmission. Can you hear me?
On vous entend très clairement, je vous en prie.
Yes, we hear you loud and clear. Thank you very much. The speaker says she can hear an echo. Okay. So cooperation is very important during the crisis because countries must coordinate their efforts, even though we understand that each country must implement measures that are specific to the country because there's a local context that must be taken into account. To each have different measures does not question the need for interstate cooperation. And this cooperation is extremely important. Firstly, to share resources. For example, at the beginning of the crisis, we saw that certain French patients were sent to hospitals in Germany, for example. And so there are countries that lend each other tests or beds or other things to try and help each other out when means are insufficient in a country. So this cooperation is extremely important to stop the progress of the virus. What is very important, it's very important during the crisis, but it's also very important between crises because collaborating during a crisis requires a collaboration mechanism, and we must have the same indicators. For example, we saw in the flu pandemic of 2009 that we could not compare the data between the countries because, for example, some countries were not using the same figures for hypertension. So what was considered to be hypertension in one country was not hypertension in another country. So it's a detail, but it can make cooperation very difficult and the risk evaluation depending on the country. So that's why collaboration is very important in order to help us to understand how to adapt the measures to a particular context. And you need to prepare this upstream of the crisis in order to be effective.
Une connexion avec l'Italie.
Thanks so much. We're at last going to be able to have a connection with Italy and Dr. Maria Stasi. So the Italian government decided just a few days ago to ease the lockdown, especially in Lombardy, where you are. The region is going from a red to an orange category. How do you assess the response and this management on behalf of the government of the situation in Lombardy, the pandemic, and the measures taken so far?
J'attends une traduction.
Vous êtes censé l'avoir tout de suite. Si vous n'avez pas, je vais peut-être improviser.
You're supposed to have the translation. If you don't have it yet, I'm going to improvise.
Est-ce que vous avez la traduction?
Mon français, c'est très mauvais. Moi, je pense que le passage orange.
I think that the current period is very dangerous. Because we must be very careful. So we're going to try and solve the problem of translation. Professor Giuseppe Ippolito, are you with us and can you hear me to begin with? Yes, I can hear you. Perfect, perfect. So, and my French is very bad. I can speak to you in English. There is a translation for you, normally. I hope that the connection will be better. I am going to ask you my question. It would seem, as I was saying earlier on, that the virus has been circulating in Italy since September 2019, not just the beginning of this year. And we know that Italy was the first Western country to be affected by the virus. So I would like to ask you what the situation is like today in your country.
In Italy, after the first case detected the Chinese strain pushed out. What is the endemic situation now in Milan? Some data that this is very difficult to understand, that data need to be validated, and I'm not sure that we have so early circulation. A new scenario in the world. I hope that the scientists will evaluate the data, and competent authority will perform a new evaluation of information. How Italy is reacting to the second wave using the best of the wave. During in the March, Italy was the first country in February and March, and I believe that the restriction and the lockdown activated very effective, and the situation is still, we have a problem. We have a problem in terms of new cases, but new number. This is really critical. Now we are dealing with a new problem, despite the cases reached maybe the plateau, and in the last week number of cases decreased. Of the deaths that died pressure in the past month.
Bon, nous avons clairement un petit problème tout de suite dans la connexion. On va peut-être essayer. Professeur, je ne sais pas si vous m'entendez. Professeur Ippolito, je ne sais pas si vous m'entendez, mais nous avons un petit problème technique à régler avant de revenir vers vous.
Professor Vito, we have a technical problem to solve before we come back to you.
On essaiera de régler tout ça et de revenir vers vous. Je vais reprendre en espérant que la connexion est peut-être meilleure avec le professeur.
We're going to come back. We hope the communication is better with Professor Halal in Algeria.
Aujourd'hui, on l'a vu, le gouvernement algérien a annoncé cette semaine le prolongement du confinement partiel à domicile dans 34 wilayas du pays pour une durée supplémentaire de 15 jours. Et ce
You've extended the lockdown in your country for a duration of 2 weeks as from the 2nd of September. So how are you managing the situation today? And what is the situation in terms of positive cases in Algeria?
De communication de l'épidémie aussi importante dans le sens.
We haven't had such a serious epidemic since the Spanish flu at the beginning of the 19th century. Currently, the situation is under control. So our response is that we're trying to lead upstream actions so that we don't have as many people requiring hospitalization. But we are still trying to manage things so that social and economic life can be maintained. There is a second problem, and I think that this problem concerns the entire world. So the question is, to what extent are we going to make available to COVID patients the beds that are supposed to be intended for other types of operations or disease management? So we're trying to organize the hospital plateau, and we hope that the epidemic will decline. Thank you very much, Professor. We're going to try to come back to Dr. Maria Beatrice Stasi. It would seem that the translation problem has been solved. So, Doctor, I'm going to come back to you to talk about the situation in Lombardy. The restriction measures have been eased. We've gone from red to orange. So how are things currently in your region? And how has the pandemic been managed so far in Lombardy?
Io credo che il passaggio alla zona arancione sia un passaggio che le persone devono fare in modo molto cauto. Nelle strutture ospedaliere della Lombardia siamo preoccupati perché a Bergamo in particolare abbiamo vissuto una prima fase dove siamo stati i primi nel mondo occidentale ad essere aggrediti dal virus in una maniera assolutamente violenta, con 2200 pazienti gravi, bisognosi.
I'm very sorry, but the relay is not working.
E la necessità di allestire un ospedale speciale anche in un posto diverso dall'ospedale alla fiera di Bergamo. Quindi abbiamo vissuto veramente la pandemia in uno stato di emergenza.
Nous avons dû aussi véritablement mettre en place des structures.
So we had to set up additional structures outside of the main hospitals. In Lombardy today, we have a very high number of positive cases in the first wave, which was a very brutal wave. And we are also supporting the efforts undertaken by other structures because 70% of COVID patients come from Lombardy. And currently, we are waiting for the vaccination and currently speaking, we're concentrating on social distancing. And we really need to respect these conditions. But of course, in Lombardy, the figures should be placed in the context of the rest of the region. If we look at the figures in Lombardy today, as you know, in the first wave, the number of positive cases was 5 times higher than the figures in other regions, whereas at the time we were not testing systematically. That is why I think that our results and the way in which we manage the crisis should be placed in perspective with regard to the situation, because we would never have thought we would have to face such a serious breakout. And today in the hospital setting, we're extremely concerned because the second COVID wave is slowing down, but we're worried because we expect to see a third wave, and we're afraid that this third wave will come before we find the vaccination.
Dr. Stasi, I'd like to ask you precisely about what you've just said, these hospital structures. When we take a look back in time, when we take a look at the current situation, might one not think that we could have cooperated better, particularly in between hospitals? Of course, it's so important to cooperate between hospitals. In Italy, we recognize that it was important to have a territorial type of healthcare. Now, what do I mean by that? Well, we've got prevention, a prevention chain, if you like. That is the ability of tracing the patients and isolating the virus. And that, the ability to do that, is linked to the number of cases. If the number of cases goes above a certain threshold, then it becomes extremely difficult to trace. So that is why social distancing is so important in the combat against this pandemic. And also it's essential to act in terms of primary health care, which is being dispensed by independent healthcare workers, and these independent workers will sign a national contract. The situation is very difficult because they are independent workers who are giving the care. They are not they're not salaried employees, and so they could be a kind of layering effect with the hospitals in Lombardy. We have done everything possible to implement the right protective measures. The hospitals are well equipped. But here we are not only working with salaried employees, but also with independent workers. And that is causes some duplication. We have the GPs also who can work with the elderly, for example. And they can intercept, they can treat the patients before the patients go all the way through to intensive care, for example. And that is a very important subject that needs to be addressed. There were 2,200 serious cases in the first wave, and we had to send those 2,200 people back to their homes. And then we had to monitor their cases to understand the consequences of COVID. We needed to understand what the patients experienced once they left the hospital. So this territorial healthcare has to reflect that. We have to make some modifications here in Italy. But this is a debate that still needs to be continued. Well, thank you very much. I would like to come back to Giuseppe Ippolito, hoping that our connection will be better this time. Perhaps I'd like to know if you can hear me to begin with. Very good. I think you can hear me and that you will get your translation. So, yes, I can hear the translation now, thanks to the Zoom platform. Well, that's what we wanted to hear. I'd like to ask you how we can embrace the future. Can we be positive? Will this vaccine give us true hope? Well, we do not yet have the vaccine, as we all know. We need the political will to get that vaccine out there. But sadly, in some countries, we will not be able to vaccinate the entire population. So, we will have to vaccinate as many people as we can, even if it's a small number of people, and that vaccine will need to be very efficacious, and it will have to be administered to as many people in the population as possible. The vaccine will have to be effective on a large scale, but the vaccine is only one part of our response. Well, thank you very much. Thank you, Professor. I'd now like to talk about a big issue which is linked to this fake news which is bubbling up all over the place. At the beginning of the pandemic, we heard it about the masks, there was some about screening, and today there's a lot of fake news about the vaccine. I'm going to ask that Dr. Emanuele Angelakis can hear us, but in the meantime, I'll come back to you, Sylvie Briand. As I've just said, this is a huge risk. And are we not running the risk of seeing mistrust toward public policy? Because it's becoming a public health threat. Yes, it's an infodemic, as in information and pandemic, if you like. So, it's important that people can take the right decisions. When there's too much information, you don't know what to believe, what to think, and I think it all becomes very chaotic. The problem in these situations is twofold. On the one hand, because people are really connected to social networks, During lockdown, people were looking at the social networks all the time. They were having access to all kinds of information. And we saw an increase in fake news because people were repeating that news and sending it throughout their own networks. And so another problem is that some of this information is very controversial, and it's not nuanced at all. And so that divides the population into two camps, those who are for and those who are against vaccination. When you're talking about a vaccination, an epidemic, you all have to work together. The population has to be committed to combat the epidemic, because the epidemic is passed from one individual to the next. So each individual has a role to play to stop the virus from spreading and to reduce the impact that it has. So we all have a role to play in this information pandemic, this infodemic. We have to be careful about what kind of information we pass on to our own contacts, because it can be harmful. We have to live harmoniously. As far as the vaccine is concerned, well, it's understandable that people can be afraid of the illness, but also afraid of the vaccination because it's a new vaccine. But I do think that we really have to be careful and work hard to convey the right information about the vaccine, to talk about what the benefits, the advantages are of the vaccine, without not only talk about the negative side, the risks. We really do have to engage in conversation and talk about the problems directly. Avoid sharing information which is not always very relevant, particularly at this stage in the pandemic. Yes, indeed. I think it's our responsibility. All of us have a responsibility in this. We have to all join with the healthcare workers and the politicians. At last, I'm in contact with Dr. Angelakis. So the management of this pandemic has opposed three very important axes in decision-taking, but also in how we combat the illness. There's the point of view of the scientists, there's a point of view of the politicians with governmental announcements, and then there are political reactions to all of this. Reactions to political decisions and speeches, reactions to scientific decisions and recommendations. Yes, as we said earlier on, there was a first wave, and the treatment was very efficient. We had currently in Greece, we're in a second lockdown with 3,000 cases per day and 100 deaths per day, and we have the same kind of deaths as in the first wave. So we have to combat this epidemic. We have a Greek COVID authority which didn't see the second wave coming nor recognize how strong it would be. And so they thought that using the masks and social distancing was enough. And because of this, the Greek government decided that it had won the war. But we have some beds in intensive care that are available. About 500 beds in Greece in intensive care. Another problem is that we, in fact, lost that war, and tourism, travel, etc., picked up again, was allowed again. There were no testings when people came into our country, and a lot of the Greek population thinks that there is no virus. They don't wear masks. But now 46% of the Greeks have said that they don't think there is a virus. And they don't believe the media. And so that is problematic. Thank you very much. Thank you very much, Dr. Angelakis. Talking about the vaccine, I'd like to go back to the other side of the Mediterranean to talk about Algeria and the case of Algeria. There is some information which is being passed around, which is why I want to hone in on this with you. We've heard people talk about January 2021. It's supposed to be a key month for the Algerians in terms of the virus. What information, what real official information can you share with us today about vaccination campaigns and the arrival of the vaccine in your country? Let me come back, first of all, to the mistrust of the people for the past 10 years or so. All around the world, there have been a lot of people who refuse to be vaccinated. We know that there are lots of illnesses that can be treated. It would be utopic to imagine that the vaccination is going to solve the problem. There is some data about different illnesses which might guide us. The interpreter apologizes, but the sound is very difficult and the voice is not easy to translate. You know that there are parameters for vaccination in different countries. There are different agencies, the World Health Organization, the European Health Organization, agency can give guidelines, but we also see that we have new types of vaccines that are being developed, but we also have other factors. So the Scientific Council, which I sit on, have some decisions to take. We have been working since August, but as for the dates, we don't know anything about dates because nothing has been decided so far. So we are working and we have a spokesperson for the Scientific Council who will make announcements when the time is right. So I hope I've answered your question. Well, thank you very much. Thank you, Professor. Dr. Maria Beatrice Stasi, I'm coming back to you in Italy. We know that we're not out of the woods yet. There's a lot of hope in the vaccination, but we have not yet started our vaccination campaigns. Is there any lesson to be learned at this stage in the game in how the pandemic has been managed around the world? Because we've been coping with it for about 10 months now. So is there any lessons that we can learn already, perhaps from what happened in China or what we've experienced ourselves? What conclusions can we draw when we get through this epidemic? We're going to have to continue to live with it, perhaps, or we're going to have to do things differently in the future. Well, I believe that we are going to have to cope with this virus. We are going to have to sort out what's real news and what's fake news. In Italy, in our country, public opinion is quite vociferous. In Italy, there's a no vaccination movement, Novax, which is working and is meddling with public health issues. And We have a vaccination committee. So we have to combat those who are saying that the virus doesn't exist, because of course we know it does exist. There are concrete risks, we need to identify them. We have to be very fast in the way that we work.
Dovremo essere velocissimi anche nella vaccinazione, perché sennò dovremo
So we are going to have to, as soon as the vaccine is available, we're going to have to work very quickly to vaccinate our population. We have to be ready to get out there and vaccinate people. Yes, hopefully in a few weeks that will be the case. So far we've been fighting with COVID for about 11 months now, or a long time anyway. And so we want to get back to normal as soon as possible. We need to be very quick and ready to vaccinate as soon as the vaccine is available. But we have to cope with this no-vax movement as well, which is very difficult for us here. Because we hope that 2021 will be a better year for everybody. Yes, we all hope that 2021 is going to be a better year for everybody. I'd like to hand the floor to Sylvie Briand to give us a final message. What message would you like to give to people who are listening to us here today? And can we cling on to a hope whilst remaining very responsible, because the pandemic is certainly not behind us yet?
Yes, I do believe that the virus will continue to circulate. And I believe that we can reduce its transmission, and we've shown that this is possible when everybody makes an effort in that direction. But I think that in the future, we need to find a good balance between health protection measures, but which unfortunately have a rather harmful effect on the rest of our lives, meaning the economy and social lives. So we need to calibrate our response as best we can, so that we can protect people's health as far as possible without having too great an impact on our other activities, and in particular economic and social activities. Concerning vaccination, once the vaccine is available, I think that things will be a bit different, and we will be able to revisit the situation. Thank you very much, Sylvie Briand, Director of the Preparation of Emerging Disease for the World Health Organization. Thank you to Giuseppe Ippolito, Professor at the National Institute Lazzaro Spallanzani for Infectious Disease, who was speaking to us from Italy, Dr. Maria Beatrice Stasi, General Director of the Papa Giovanni 23 Hospital in Bergamo, Italy, Dr. Emanuele Angelakis, who was with us from Greece and who is member of the Scientific Council of the Greek Pasteur Institute, and thank you to Professor Herrera, who is General Director of the Health Department and Ministry of Health in Algeria. Thank you very much, all of the guests, and thank you for having listened to us. Stay with us. We'll be back in just a few moments, because we're talking about vaccinations. We're going to speak about this interview with our testimony, Stéphane Ponce, the General Director of Moderna, and everything we've learned from him on this vaccine, when we'll be able to start to be vaccinated, and what about countries in the Mediterranean. See you in a couple of seconds. Thank you.